Dear students, welcome back. In the previous session, we have discussed about bilateral stance. Now in this session, we are going to discuss about unilateral stance. So unilateral stance means a standing on a single limb. Here in this pic, you can find the left leg has been lifted from the ground and the full superimposed body weight being supported by the right hip joint. Okay, here there is no sharing of the compressive force of the upper body weight with the left limb is seen, and the right hip joint must now carry the full burden. Not only the weight of the upper body, it has to weigh the left limb also. Okay, as we know that 2/3 of the upper body, yes, 2/3 of the upper body, we have taken 180 lb as the weight of that person. In the previous example, I have taken the same weight, that is 180 lb. So here the 180 lb is the upper, 2/3 of the 180 is upper body weight, that is HAT, that we will get 120 lb. We got 120 lb, and this 120 lb is going to divide for the two limbs 60 lb and 60 lb, isn't it? Now it is not happening here. So and here what will happen is, so the as we know that the lower limbs will have the 1/3 of the body weight. So 1/3 of the body weight means simply we will get 60. So that is the thing. So whatever the 60 lb is transmitted to the left limb, which is going to add the weight. Now we will get, so the entire 60 is for both the limbs, total weight. Now only the left leg we have to take. So half of the 60 is 30. So 30 we have to take. So total 150 lb. So total 150 lb of compressive force is take over by this right hip joint. Okay, yes. Now normally in the bilateral stance, so the right hip is taking the compressive force of 60 lb. Now in the unilateral stance, it has taking so much of compressive force, that is 150 lb. Okay, so here the problem is more complex because the hip joint is not only being compressed by the superimposed gravitational force. So superimposed gravitational force, that is the compressive forces by the weight, and also now it is affected by the gravity which is creating a torque around the hip joint. So not only the weight of the body, and now the torque which is creating by this gravity is around the hip joint is also affecting the stability at the hip joint. Okay, now we will calculate how much torque is created by this gravity, and we can, this gravitational torque is also called as gravitational adduction torque at the right hip. So this, if you want to calculate the torque, so the momentum of this what LOG and this compressive forces is the 4 inches. Okay, the momentum is 4 inches. Normally in individuals, in different individuals, the distance, actual distance may vary. Here I am taking some examples here. So now what is the torque produced here? So torque is equal to F into D, that is the shortest distance from the joint axis to the action line, isn't it? Yes. Now what is the distance now? Yes, torque is equal to, we know the distance momentum, F into D. Yes. So what is the force? That is weight, total weight, which is acting 150 L into the distance is 4 inches. 150 into 4 will get 600 lb, inch lb. We can call it as 600 inch lb. Okay. So to maintain the single limb support position, so there must be a counter torque of equivalent magnitude. So for this torque, this adduction torque, there must be a counter torque must be produced. That is, abduction moment is produced. That one is produced by abductors. If it is not produced, then the pelvis will drop. So if the pelvis will drop, how it falls means the trunk will follows the pelvis, the person will fall to the unsupported side. So the counter torque must be produced by the activity of the hip abductor muscles act through a typical momentum here 2 inches or 5 centimeters. Okay. And knowing the gravitational torque, we can calculate the magnitude of the muscle contraction needed to maintain equilibrium. As we know that, so this is the gravitational torque, how much? 600, and this has to be counter torque by the hip abductors. So the force we have to calculate now, and then the distance we know, that is 2 inches. Then the abductor force, the abductor muscular force is equal to 600 by 2, then we will get 300 lb. 300 lb is the abductor force. Okay, to prevent the pelvis from falling to the unsupported side, the abductors must generate a force of 300 lb. Oh, assuming that all the muscular force is transmitted through the acetabulum, the 300 lb muscular force is added to 150 lb of compressive forces of the body weight passing through the supporting hip. So then what will be the total one? So as we know that the compressive forces is 150 and the abductor force is 300, and total 450 lb of total hip joint compression is seen. Okay, and this one is the not only total joint hip compression, and it is also called as joint reaction force. Okay, here the location of the joint reaction force can be further defined by knowing the angle of pull of the hip abductors. Okay, so what are the hip abductors? These are the gluteus maximus and gluteus minimus. Okay, the action line of the abductors has been estimated to average 22 to 30 degrees from vertical. Okay, so we have seen here this this is the resultant force actually. So this resultant force is making an angle with the vertical force. The vertical force is nothing but this weight, okay, compressive force, and it makes an angle of 22 to 33 degrees with this vertical, and yielding the force components. Now that force is resolved into two components, okay, like in this Fx and Fy. So here you can see the Fx. So the pull of abductors on the horizontally oriented pelvis will resolve into a parallel component Fx that will push the acetabulum into the center of the femoral head, okay, and a perpendicular component, that is Fy, that will pull the pelvis down on the superior aspect of the femoral head, as well as pull the ilium closer to the femur, producing a hip abduction torque. Now, how you can distribute this 300 lb, which is created by abductors, into two? Okay, as we estimate approximately 2/3 of the total hip abductor force. So what is the, we know the total hip abductor force is 300, and 2/3 of the hip abductor force is how much? 2/3, 2/3 into 300, we will get 200, isn't it? So 2/3 into 300, we will get 200 lb. So this 200 lb acting the pelvis will bring the pelvis vertically downward on the femoral head. So that means Fy. So this 200 lb is acting on the Fy direction. Okay, and 100 lb will direct the pelvis laterally into the center of the femoral head. Okay, so normally on shifting of the weight on the right side itself causes drop on the left side. So that means there may be a lateral tilt of the pelvis. For this, we have to make this pelvis vertically upward, vertically, and the forces downward onto the acetabulum. So for this, a vertical force is required, and that force is Fy of the total abductor force. And also this 100 lb will direct the pelvis laterally into the center of the femoral head, and after bringing this one, and it will keep this pelvis laterally into the center of the femoral head. Okay, so the vertically directed downward force of 200 lb will fall into the same line as the vertical force of the body weight. So this Fy will fall same as that of the vertical force. So this will fall with that of the compressive force. Okay, that means 200 plus 150 leads to 350 lb through the superior aspect of the acetabulum. So through the superior aspect of the acetabulum, it is getting 350 lb. Okay, the remaining 100 lb of the total 450 lb. So already we know that 450 is the total joint compression. The remaining 100 lb of the total 450 lb of the hip joint compression is distributed through the center of the femoral head. So the remaining 100 lb is distributed to the center of the femoral head. Okay, so by this way the forces are acting on the hip joint. Okay, so if we can simplify all these hip joint stresses and forces, we can give a statement like this: the total hip joint compression or joint reaction forces are generally considered to be 2.5 to 3 times body weight in static unilateral stance. Isn't it or not? So simply we can see here, so only 60 lb is acting on a single limb. So now how much it is? 450, isn't it? So generally 3 times more than that of the body weight. 3 times more than that of the body weight in static unilateral stance. So single limb joint. So as we know that 180 is the total body weight, isn't it? This is the hip joint force. This is not. So 3 times more than this. Okay, 180 or 2.5 times, which is almost equal to 450 lb. Okay, so the investigators have calculated or measured forces of 4 and 7 times body weight. So where this 4 times we can observe means, so this increase in joint compression 4 times during beginning and ending of the stance phase of gait. Okay, so we will see, you will know the stance phase of gait, okay, when we are dealing with gait, and 7 times the body weight in activities such as stair climbing. So simply we can say all the weight loss can reduce the hip joint reaction force. So if you reduce your weight, then hip joint reaction force can be reduced. By how many times? It is going to reduce by 3 lb. Okay. So if you lost 1 lb of weight, it will reduce the joint reaction force by 3 lb or more. Okay. And then the magnitude of the hip abductor force required can be affected by the individual differences in, one is the angle of pull of the muscles. Okay, the first one is, it is affected by abductor forces are affected by, one is the angle of pull of the muscles, and next one is angle of inclination of the femoral head and the angle of femoral torsion. Okay, and these are all the structures or the things which are going to affect the magnitude of the hip abductor force also. Okay, and if there is any paralysis or weakness of the abductor muscle force, will show, you can see the drastic biomechanical reduction in the efficiency if there is any weakened or paralysis to these abductor muscles. Okay, and this paralysis of the hip abductor muscles is considered to be the most serious muscular disability in the hip region. And also, if hip abductor muscles is not paralyzed or not weak, if other muscles are weak, then the person can able to walk or even the person can run. If the hip abductors are weak and the remaining muscles are good, then it is going to affect the hip joint seriously. Okay, and also, but such kind of joint compression in the unilateral stance leads to osteoarthritic changes in the superior acetabulum, which is very common. Okay, and the hip joint undergoes this osteoarthritic changes leading to pain on weight bearing. Okay, for that the joint reaction force must be reduced to avoid pain. So for that this we can't reduce this gravitational torque, but we can reduce our weight, but it is not easy to reduce the weight. And also we can use some assistive devices to minimize this energy. and we can decrease the compressive forces by using some assistive devices like canes. Okay, and also some compensatory movements on the upper trunk also decreases this compressive forces on the hip joint. That we will see in the next session. Thank you.